Type 1 diabetes versus Type 2. If you are as confused as many people about the difference between Type 1 diabetes and Type 2 diabetes, you are not alone. Many people don't even know that there are two types of diabetes. If you ever were, you're not the only one confused. Here's what you need to know about Type 1 diabetes and Type 2 diabetes. What differences there are between them. The onset of Type 2 diabetes is usually slower. The symptoms are not as clear as Type 1 diabetes, even ignoring the fact that people with Type 1.5 are initially wrongly diagnosed as Type 2. We get blurred periods in both types of diabetes, even with the same symptoms. Type 1 diabetes is also known as juvenile diabetes. Can occur in both children and adults. But there is a difference between Type 2 diabetes, which is called adult diabetes not insulin dependent. Type 2 diabetes can occur at any age, but is usually diagnosed at the age of 30 to 35. While Type 3 diabetes or Type 4 diabetes are typically diagnosed at the age of about 40. In the US, however, Type 1 diabetes is diagnosed in children at the age of 6, whereas Type 5 diabetes in adults is diagnosed at the age of 40. Type 2 diabetes can occur at any age. It is very common to be misdiagnosed with Type 2 diabetes, as Type 1 diabetes is very common in children and young adults. In the United States, and so-called late Type 1 diabetes can also be misplaced as Type 3 diabetes or Type 4 diabetes. A typical assumption is that people with Type 2 diabetes are overweight and constantly inject themselves with insulin, while people without Type 1 diabetes are thin. Diabetes tends to be thin when diagnosed, which is why they are often, if ever, underweight. However, there is no evidence that they were overweight or thin at the time of diagnosis. Type 1 diabetes is less common than Type 2 diabetes, but about 5% of all people with diabetes have Type 1 diabetes. The most common Type 2 diabetes causes about 1 in 5,000 deaths in the United States each year, according to the American Diabetes Association. In Type 1 diabetes, the pancreas produces insulin, but not enough, so cells do not respond to insulin as they should. Insulin does not function properly. Your body can produce insulin in other ways, which is known as Type 2 diabetes. In Type 3 diabetes, Type 4 diabetes, the pancreas can produce insulin more efficiently. Your body produces it more effectively. In Type 1 diabetes, people with Type 2 diabetes can produce insulin, but at some point, their body begins to develop resistance to it. In Type 1 diabetes, juvenile insulin-dependent diabetes, the pancreas is no longer able to produce insulin. The body stops producing insulin. In Type 2 diabetes, also called insulin-dependent diabetes or juvenile diabetes, the body does not stop producing insulin, but it does not produce it anymore. While people with Type 2 diabetes can use insulin injections to treat Type 1 diabetes, this is not common and is known as diabetic ketoacidosis, one of the most common complications of Type 1 diabetes that is not treated with insulin is diabetic ketoacidosis (DKA). If you do not have enough insulin in your body, due to the lack of insulin production in your pancreas, you can cause ketosis or something similar. Type 2 diabetes is the most common form of diabetes, with overweight adults over 40 years of age, with a family history of Type 2 diabetes being affected. It is called Type 2 diabetes, and there is no cure. Only treatment with insulin injections and insulin replacement therapy. The problem with Type 2 is that many people go through it symptom-free, but some don't. There is nothing that can be done to prevent Type 1 diabetes. There is no cure for it, only insulin injection and insulin replacement therapy. The symptoms are similar to those of Type 3 diabetes, but vary in severity, and are the result of a combination of factors such as high blood pressure, high cholesterol, obesity and lack of exercise. Originally referred to as juvenile diabetes, Type 1 diabetes can develop in children as young as 5 years of age, but also later in life, while Type 2 diabetes can occur at any age. In this video, we will look at the different types of diabetes and their symptoms, always bearing in mind that both types are incredibly challenging and life changes. Type 1 diabetes has various names, including type 2 diabetes mellitus T2DM, type 3 diabetes, type 4 diabetes and type 5 diabetes. Formerly known as type 1 diabetic retinitis pigmentosa type 1D. Also known by his name because glucose flows through the urine in this disease, his names are forgotten. YPE2 diabetics, also known as type 2 diabetes mellitus or T2 German marks, are formerly known for their high blood sugar levels and high insulin resistance.